Welcome everyone to Pathways to Wellness. I'm Joan Gennarini, licensed massage therapist, and I love just help educating people on different types of massage techniques. And today we're going to talk about oncology massage. Unfortunately, so many people have or had experienced some type of cancer-related treatments, and there's so many here in the United States that could use this type of modality, this type of massage, to help them relax and help them with their everyday wellness. And so overall, there's survival rates in 2019, there was close to about 17 million, and that's going up now to about 22 million by 2029. So there's just so many people, unfortunately, have been touched by this, but the good thing is technology's better, treatment's better, that there's more survivors. Who's impacted? All age groups, all cultures, all incomes. So it doesn't seem to just target a certain area or part of the country or a certain age group. All age groups, unfortunately, are impacted. Who can have it? Usually what you do is when you're in your program, a doctor will say, hey, you're ready for oncology massage or some type of massage. So usually some kind of doctor's referral is good, just because everybody has different types of cancer and different types of ways to go about with their healing. Is it only for the patients? No, the caregivers, even the medical staff. There's so much stress that goes through with the oncology and the cancer that anybody can actually benefit from it. So cancer survivors, a lot of them we don't even know that they've had cancer, that they're impacted. They look healthy, they're in their everyday jobs, they're in school, they might be retired, they're out exercising, they might be doing yoga, they might be instructing you in the colleges or in the schools. So lots of times people don't even realize, the public, that a person is impacted by cancer. You could be in remission for years, meaning like I was diagnosed with cancer 20 some years ago. I went through the treatments. I'm better now. You're in remission. But oncology massage can still help you. There's a lot of different things that might happen. It's a lighter technique. All right, you're not going to do deep pressure because your body's been compromised, your system's been compromised, especially if you've had lymph nodes removed. Even if they've just been tested or if they've been radiated, your system just moves a little bit sluggish, and so the massage would actually help with some of that rejuvenation of your lymphatic and your circulation system. Also, it's important if you've had blood clots. Sometimes you have the DVT, the deep vein ones in your calves, maybe throughout other parts of your body. So we have to be careful of that. And again, that's why there's a lighter type of massage. There's a lot of myths when it comes to oncology massage. For years and years, and when I started doing massage like 20 some years ago, we were told you couldn't do massage on cancer patients because the massage would actually move the cancer cells throughout the body. But what we have already figured out now, that the cancer cells are going to be shedded off, the tumors, and there's a big chemical process behind it. I do not know all that information behind it, but basically by just doing simple massages, it just helps relax and rejuvenate the body without the risk of the mechanical movement of the cancer cells. What else? It also sometimes, and we've already talked about this, sometimes people feel like, oh, I'm in so much pain, I just need a deep tissue massage to get the pain out. Again, when your system and your body's been compromised, you want to make sure everything is nice and soothed and light for the massages. The benefits of oncology massage, there's a lot of benefits out there. Provides relaxation and better sleep. Lots of times people can't sleep very well, they're nervous, they're got a lot on their mind. By just providing that soothing touch, the oncology massage, that will help with better sleep and reduce stress, pain, anxiety. Those are good benefits that it reduces. Some people say less nausea. It's like when you go through the treatments, tend to be, the nausea comes up, helps soothe down the nervous system, creating that. And even constipation, unfortunately, we have that. It helps with the elimination of some things that get stuck there. It improves your body self-image. So lots of times we just feel really down upon ourselves. And by just having that upbeat massage will help you feel better, help your own image, and it improves mental clarity and alertness. So sometimes we get in this brain fog. And by, again, just moving the lymphatics in your system, circulation, the nervous system, just helps with that ability to be alert, be mental clear. There are modifications that need to be done. There's also contraindications that might happen. And so when we do that, we were talking earlier about tumors. Now, most tumors that are detected in cancer, again, I'm not a specialist, but this is kind of what I've heard over time, they tend to be deeper in the body, right? They tend to be in your organs. And as a massage therapist, we're not going down deep into your body, so we're not going to impact or affect those tumors. But if you have a tumor that's more surface oriented, and we as massage therapists are told to avoid those areas, that would be one of the risks of just impacting the tumor directly with our hands. But like I said, most of the tumors are so deep that we as a massage therapist cannot impact that. It's a contraindication. Again, we talked about the DVTs, those deep blood clots that are in your blood vessels. Those tend to be in your calves. But you can also have blood clots like in your pecs, places in your arms. So we just have to be aware of that. You have to let us know if you've been diagnosed. Sometimes we cannot see that, obviously, because it's deep into your system. If you have infections, that makes sense. If you're sweating, if you have any kind of fever, you want to not get massages. And that's in any kind of massage, not only cancer-based, but any type of massage. Skin sensitivity, you may have some rashes going on. You may be allergic to some of the lotions. So you just want to make sure that we know about what's going on with your skin, so we're not compromising any additional things on your skin with the movement of our hands. Let's see what else. If you have low white cell blood count, or if you have low platelet counts, again, that's more of like talking to your doctor. If you're kind of in that autoimmune part where you're really low, probably right then as you should not have massage. And that's, again, talking to your doctor before you're approved to have the massages. And lymphedema, so more and more massage therapists are getting trained on how to do some basic manual lymph drainage, but not all massage therapists know how to do that. So if you have a lot of swelling, if you've had lymph nodes removed, especially a lot of breast cancer in this area, maybe you've had some kind of throat cancer, or maybe stuff in the groin or the colon, and if you're swelling any part of those body parts, you need somebody that knows how to work with it. So for example, if you've had some lymph nodes removed here, if you're massaging, it needs to go up to healthy lymph nodes up here. Or if you've had something going down here removed, then you need to move up here to where there's healthy ones. And again, that's just that dialogue you have with your massage therapist and with your medical doctor. And make sure you have somebody trained. With that, we are going to take a few-minute break, and I'm going to have my volunteer, Miss Lindsay, come in, and we're going to actually demo how to do the oncology massage. Thank you. Welcome back to Pathways to Wellness. We're going to do a demo now with oncology massage, and I have Lindsay here. She works with Yazoo, Young Adult Survivors Unite, and she's going to tell us a little bit later on about what all the wonderful things that organization does for the cancer survivors and the people going through cancer too. But like we were talking about earlier with the oncology massage, we need to know a little bit more information. So tell me anything about going on with you, Lindsay. Have you had treatments before, or were you just going to demo on you? I'm trying to remember, yeah.
Just demo.
Just demo, okay. So basically, if she had gone through treatments, what we would do is I would say, when was your last surgery? And she would say, maybe it was a few months ago, maybe it was 6 years ago, whenever it was. I'd also ask, basically, has she had a radiation treatment or a chemo treatment recently? For me, as a massage therapist, I would need to wear gloves because I don't want that to come through her skin onto me. And we also need to make sure there's enough time for her and as a body to adjust for that. And also we need to use the guidance of her current doctor. So sometimes it's a couple weeks, sometimes it's 6 weeks. It's usually a couple weeks after treatment. And then again, if she had cancer in a certain area, lymph nodes, if there were lymph nodes removed. I was saying earlier, if that would be like in her armpit area or in the groin area or up here in the throat, those are the common areas usually where some lymph nodes are removed. And what I understand too, like when I was doing this 20 years ago, more lymph nodes were removed then. Now they're getting a lot better just to test them and review them and leaving them in the body versus taking them out. So with that, what we're gonna do, we're gonna have her just lay on top of the table. Obviously, if you're getting an oncology massage, you would undress to your comfort level. We're not gonna do this on this TV show, but she would undress to her comfort level. She'd get underneath the sheets. We usually start face up. So she's just gonna lay with her clothes on top of the sheets, and she's gonna take her shoes off, just like in real life. I'm gonna move back here for a second, okay? And there you go. We're just gonna move that out of the way. So she's got a beautiful body here. So what you normally do is I'll have some cream, different types of massage cream. So I am going to, first of all, there's a lot of different ways you can do this. Usually we start upper body first, and I'm gonna assume right now that she has her lymph nodes here, okay? So I'm going to use some massage cream. She's got her clothes on, so I'm not gonna use much. But if she didn't have clothes on. And what you're gonna do is, hopefully, can you guys see me okay? I'm gonna go like this and go up her arm. And you basically, what I'm gonna do from the other side so you can see me better and I can feel a little bit more comfortable. So basically what you're gonna do is, I wanna make sure this area is open first whenever you've had any kind of congestion. And that's a little bit like manual lymph drainage. So as we open this up, then we can do more of the arm. We wanna make sure that we're not gonna cause any kind of edema. And we're gonna take all of her blood and fluid up here so it can drain really well. And when I say fluid, like the lymphatic fluid. But also we're just trying to nice and lightly massage the skin tissue, the muscles. Does that feel pretty light?
Yes.
Yeah. So I'm not gonna go really, really deep. Her system's been compromised. We wanna go nice and light with it. And we're also, do the fingers. Again, we wanna move the lymph and the circulation up here. Okay, there we go. You can put that down. And so then I would go to her next arm, her other arm, her next arm. Again, I'm gonna start up here towards the top, work on opening up that lymphatics, and then I'm gonna move down a little bit. And again, you could use oil or cream. Like I said today, I brought some cream. And we're gonna do her hands. Does that feel okay?
Yes.
Okay. And you just check in all the time with your clients on the table, because you want to make sure they're comfortable. You want to make sure that the pressure is nice and light. Even though they say, oh, you can go deeper, again, we have to make sure it's a lighter medium pressure. Again, you can go up in here into the chest area. I'm going to be really careful and bring it up into here. I'm going to actually sit down on this massage stool chair here and go up into her shoulders a little bit. I know you can't see me here. I'll go around to the other side in a second. But I'm just getting on her shoulders there. And then I'll move over here. This is a speed massage. There you go. And I'm just doing nice, gentle, kind of long strokes. You feel that okay?
Mm-hmm.
Good. And so there's like a pillow here. I'm gonna pull this out for a second, just like so I can get a little bit closer to you. Some people want a pillow, some don't. Go ahead and lift your head up a little bit. I'm going to take this out so you can see. So the back of the neck, I'm just going to go down in here. Now again, if she had lymph nodes moved here, I'd want to make sure I take it down. When I say removed here, I'd take it down to a place where there was non-compromised ones. Same on this side. If these were compromised, I'd make sure I'd go to ones that were not compromised, which would be the neck area. So you don't want to stress her out too much, but I did that mainly so you guys could see. I know sometimes people will have cancer up here in their face. Again, you just have to be really careful. Whatever structure has been either worked on surgically or radiation or chemo, and you just want to make sure that they're comfortable in moving the circulation and lymphatics in a safe way. And I had said earlier, the massage can't actually mechanically move any of the shedding of the cells. Just regular exercise can do that, and we're not going super deep in there. I'm not trying to get into her stomach or into her any of the, like, you know, the breast area or anything that's might have some of the tumors. And then as you come down further, you can do the tummy again, as long as even if there is cancer here, as long as there's been some time that's elapsed to make sure. And then again, if there's some lymph nodes removed, you want to go to the healthy ones area. If there's not, you can always, you know, here, you can always come down to here. So it just all depends. And then you're going to go down into the leg area. Again, if this was her skin, I would have massage cream on. But we're just going to go up into the hips. You always do up here first, so it's like a toll. What you want to do is you want to make sure that anywhere the drainage is open, just like if you're paying a toll on a toll road, you can't get through the toll until those cars in front of you get through. Same thing with any of the lymphatics, any of the metabolic waste we're trying to get out of the system. And then you keep going down further and further. I'm going to have you lift your knee. So even in this position, you can go behind and massage up. And the calves you can massage up. There you go. Okay. There you go. And then the same with the other side. You're going to do up here close to the groin and the hip, bringing it up. Then the thigh. You're going to lift your knee a little bit. Yep. There you go. Put that down. And what is a massage typically? At least half an hour. I'm doing kind of a speed massage here just for demo. A lot of people like the hour massage. 90 minutes might be too much for people that are going through their treatments. But I would say anywhere between a half an hour to an hour, depending on where you are in the process. And now, if you've been in remission for a long time but want it, and we still need to kind of watch some of the protocol of lymph nodes removed and lighter touch, you know, usually an hour, maybe 90 minutes would be. And when I say remission, you know, you've been in it for several years, and you just want an overall relaxing massage. So I'm going to have Lindsay go ahead and sit up. She's going to move her feet off that way. Let's say you feel uncomfortable laying down. She can even sit on the table. There's massage chairs. So those are massage chairs you might see at fairs or at like the mall, where you can lean forward and the back is open. So again, as a massage therapist, and as you, as a person in receiving sessions or receiving treatments is what I'm trying to say, you just need to communicate that you're going through treatments. It's not that you can't have them, but we just want to make sure we go lighter. Okay? Now what I'm going to do is have her go face down so you can see a little bit what I'm doing on the back for her. So again, you have this going on. Okay, I'm going to take the pillow, Yep. There you go. You all right?
Yes.
Okay. And then I have this bolster that can go underneath her feet. And we could have, when she was face down, it could have gone under her knees too to help her back. So there's a lot of ways to make the person comfortable. There's bolsters that are thicker, not as thick. You can use towels, whatever makes comfortable. So again, we're just going to do nice, kind of a medium to light touch. You don't want to go too deep. And really what you want to do is massage, but without like really moving a lot of the skin and muscle tissue, which seems kind of counterintuitive to a massage. But you're trying to get that surface moving in a way that impacts the nervous system. And the nervous system, when it's being touched, even though you're not going and doing deep work, the nervous system says, oh, this is nice. And it just naturally relaxes. It naturally lengthens your muscle tissue and your skin tissue, the dermis. Our bodies are really good at that. So again, I'm trying to take things up here into her hopefully healthy lymph nodes up here. If those are compromised, then into this area, which is the armpit area, or down here where you've got a bunch over in the moving around to the groin area. You do have some drainage back here behind the knees too, but we tend to go more up towards, like, let's call it the heart. Everybody knows where everybody's heart is, so you want to target going up the body, ending your strokes that way. And then you can do the back. I had her lift her knee up and I went underneath when she was on her back, but we'll do it again this way. Now get the bottom of the feet. There you go. So it's just very simple. Everybody loves to have the head done. Think about when you get your hair cut and they're always massaging your hair when they wash it, your head. It always feels good. Again. All right, we're going to get up nice and slow. I'll pull this out. There you go. So I'm going to sit next to her on the table. I know that was just a little fast demo. So what do you feel? Look at you. You're all bright-eyed. Can you see that, guys? She's all bright-eyed. So how do you feel?
Feel very good. Very relaxed.
Okay.
And comfortable.
Good. And it wasn't too deep, right?
No,
Yeah.
Everything felt very superficial and just at ease and soft and smooth, yes.
Yeah.
There was no resistance, no pain, nothing.
Yeah.
Yes.
So that's the whole thing when you're doing, when you're trying to do oncology massages, to keep it comfortable for the person. They've already gone through enough trauma, enough worry, enough treatments, nausea, other types of things. You want to just give them that inner peace that they can have for those few minutes. So
very relaxed, very
good.
calm.
All right, we're going to take another quick break and we'll be back in a few moments, okay? Thank you. Welcome back to Pathways to Wellness and our demo here on oncology massage. I've got Lindsay here with us today with Yazoo. And you just saw me kind of go over the beginning of what oncology massage is, its benefits, its contraindications, what is cancer or how it's impacting. I didn't go into what actually cancer is. So just for a review, there's an increased survival rate, which is yay. Unfortunately, more and more people are getting diagnosed. Maybe there's better diagnostics for it, but there's also better treatments. But there's a huge amount of population out there, and it doesn't really matter what age group you're in, what income group, your cultural background. One of the biggest myths that we like to make sure everybody understands that massage does not spread cancer. Yeah, you might feel a little uncomfortable through your treatments, but massage, what it does is just help with the calming of your systems within your body. Obviously contraindication if there's like tumors, surface tumors, but most tumors are so deep that we as massage therapists cannot get to. Also, if you have healthy lymph nodes, it's great that you want to move the massage strokes techniques towards those healthy ones. If you've had any removed or compromised or tested or radiated, we want to make sure that we make sure the drainage goes to the healthy ones and away from those ones that aren't as healthy. Decreasing the pain increases mental clarity, decreases stress. There's all these great things that oncology massage can do for you. And you can also do it in a smaller, compact time if you need to. We need to be careful of any undiagnosed blood clots and also DVTs. We just can't, we just have to make sure that none of that gets compromised through the massages. Also, we want to avoid if you have low white blood cell count or low platelets, and that's something discussion you'll have with your doctor. So coming back here to Ms. Lindsay, tell me again a little bit how you felt and maybe some of the things that in your organization, what you might hear that people, why they don't have oncology massage.
Yeah. I felt great after that brief massage. That was perfect. I feel very calm, very relaxed. Any part of my body that was sensitive felt treated really well, which is perfect. Some of the things that we hear from members in our community, survivors, a lot of times they're already sore from treatment or things that their body has gone through, so they're afraid to get a normal massage because it might be deep tissue where you then are sore after your massage. So they're trying, they have that fear, or their skin's so sensitive from all of their treatment and things that they've gone through that they don't like being touched. So just being aware of that is really important, and I think you did a fantastic job at that light touch and this and being aware of that. And also, treatments take up a significant amount of time. So between that and then trying to maybe raise a family, have a young family, go to work, all of those things, sometimes people feel that they don't have time to dictate, another hour to go get a massage just to treat themselves, even though it might help them. So being able to do it in a compact half an hour, that would be game changing as well.
That's great. Thank you. Thank you for the feedback. For the fears. Now, I want you to tell me a little bit about Yazoo and what you guys do. I mean, I learned about this organization maybe a couple years ago with Stephanie, who originated it or founded it. So yeah, go ahead and tell me a little bit about it, or us.
Yeah. So Young Adult Survivors United, we provide social, emotional, and financial support to those who are diagnosed with cancer between the ages of 18 and 45. We're located up in Wexford, Pennsylvania, so we do have in-person socials here and in-person fundraisers. We also have our monthly distribution days at our office where members can come up and receive household items and hygiene products that they need for their homes. And we also have a national platform. So we have virtual support groups for survivors, caregivers, LGBTQ+, and then we also have virtual socials as well. So we do like virtual paint and sip nights, virtual bingo, everything like that. So anyone can join from all over the country. We also have our financial assistance program where we're able to provide grants to survivors to help them pay for rent or mortgage, utility bills, or just to help pay for groceries and gas to get to their chemo appointments. And then we also have our overnight respite trip program called Ray of Hope. So members can actually apply and take maybe day-long or overnight trips with their family or by themselves to get away and relax, either before, during, or after treatment. They kind of dictate and figure out exactly what they want to do, and we make that little dream come true.
That's great. I mean, this organization's amazing. And what Stephanie, right?
Yes.
The founder. So what Stephanie was telling us was she's a survivor. She had some kind of cancer in her 20s, right?
Yes. Yep. She was diagnosed at age 20, right, or 2 weeks before her 20th birthday. So diagnosed and realized that, there was no support for this age group. She didn't fit in with, children, and would go to support groups, and everyone's in their 60s and 70s. So that's how she founded it.
Yeah, so, and it was just inspiring to hear her because she's been in remission, right?
20 years. She celebrated her 20-year cancer anniversary this year.
Yeah, and so she's been providing this for this age group that sometimes gets left behind. And the one cool thing that you guys just had recently was called Wig Out, right?
Yes.
So tell us a little bit about Wig Out.
Yes, so Wig Out is our largest event of the year. It's the largest Halloween party in Pittsburgh. So we had about 600 people this year, and we have it at the second floor of the Rivers Casino, and everyone comes and wears a wig. So you don't know who's a survivor, who's not a survivor. They get to blend in. And if you're not a survivor, you realize that, oh, wigs are kind of itchy and hot and a little bit uncomfortable by the end of the night. But it's just a wonderful celebration that we get to celebrate our survivors. We bring everyone up on stage to support them and just salute to them, which is fantastic. And we raise a bunch of money that we're able to provide, again, financial assistance and those socials and things for our members. So it's fantastic.
Well, thank you so much, Lindsay, for being here and
Thank
being my
you.
body and telling us about Yazoo. And just thank you, listeners, today for tuning in and just realizing there's all types of healing and wellness out there for you. Today we talked about oncology massage. Anybody can receive it. Again, you might just want to check with your medical doctor and see how you feel, but usually it makes you feel better. And even if it's just for 15-20 minutes in a massage chair or 30 minutes on a table or an hour, it's all about you and your health and your recovery and being well. So thanks. Until next time, be well. Thank you.